This portion of the body mainly contains the upper limb, with the structures present in the back of the trunk. Surface landmark. The scapula or shoulder blade is placed on the posterolateral aspect of the upper part of the thorax. It extends from the 2nd to the 7th ribs. The crest of the spine of the scapula runs from the acromion medially and slightly downwards to the medial border of the scapula. The inferior angle of scapula is above the 8th rib and to 7 thoracic vertebra. The iliac crest is curved bony ridge lying below the waist. The anterior end of the crest is the anterior superior iliac spine. The topmost surface of the iliac crest is in the plane of L, 4 lumbar vertebra. Features. Muscles connecting the upper limb with the vertebral column are the trapezius, the Latissimus dorsi, the Levator scapulae, the rhomboid minor, and the rhomboid major. Superficial layer muscles of scapular region. Trapezius. Origin. For understanding the origin and action, this muscle is divided into 3 parts: superior part, middle part, and lower part. Superior part originates from external occipital protuberance, superior nuchal line and ligamentum nucha. Medial part originates from C7 to T4 spinous process. Lower part from T5 to T12 spinous process. Insertion. This muscle is inserted into posterior border of lateral 1/3 of clavicle, medial border of acromion process, and upper lip of crest of spine of scapula. Nerve supply. Spinal part of the accessory nerve that is 11th cranial nerve. Action. Extension of neck. Lateral flexion of neck. Upper fibers of the muscle elevate the shoulder. Middle fibers retract the scapula, and lower fibers depress the shoulders. Latissimus dorsi. Origin. Origin of Latissimus dorsi takes place from iliac crest, lumbar fascia, spinous process of T7 to T12 vertebra, lower 3 to 4 ribs, and inferior angle of scapula. Insertion. Floor of bicipital groove of the humerus. Action. Latissimus dorsi causes adduction, extension, and medial rotation of the arm. Nerve supply is by thoracodorsal nerve. 2 important triangles are related to Latissimus dorsi: lumbar triangle and triangle of auscultation. Lumbar triangle, also called as triangle of Petit. It is situated above the iliac crest. Boundaries. In front of the triangle bounded by the posterior border of external oblique muscle. In behind, it is bounded by lateral border of Latissimus dorsi muscle. Base is formed by iliac crest. Apex is above and formed by meeting point of external oblique and Latissimus dorsi muscles. Floor is formed by internal oblique. Triangle of auscultation. boundaries, medially by the lateral border of trapezius, laterally by the medial border of scapula and a part of the rhomboid major, below by the upper border of the latissimus dorsi. Deep muscles of back are levator scapulae, rhomboid minor, rhomboid major. Levator scapulae originates from the transverse process of C1 to C4 vertebra. Insertion takes place in medial border of scapula above the spine. Action: elevation of scapula and extension of head and neck. Nerve supply by dorsal scapular nerve, rhomboid minor, originates from spinous process of C7 and T1. Insertion takes place into medial border of scapula and base of the spine. Action of this muscle causes retraction of scapula and downward rotation of scapula. Nerve supply is by dorsal scapular nerve. Rhomboid major originates from spinous process of T2 to T5 vertebra. Insertion takes place into medial border of scapula, inferior to spine of the scapula. Action: retraction of the scapula. Nerve supply is by dorsal scapular nerve. Clinical anatomy: lumbar triangle is potentially weakest part of abdominal wall. Hernia can occur at this triangle. Breath sounds can be clearly heard in triangle of auscultation during auscultation.